This is Chicago's very own WGN Evening News at 5.
The Trump RX website launches today. It will allow people to buy medications directly through the new government portal. Medications will have discounted prices. The White House negotiated with drug makers, but the site will require patients to pay out of pocket. It's expected to mainly benefit people who don't have health insurance. So join us to talk about the new program and how it works is Dr. Jeffrey Sterling, the president and CEO of Sterling Healthcare Implementation Firm. Good evening, sir.
Good evening. Good to be with you.
Nice to have you. First of all, we hear a lot about Trump RX, but what is it exactly?
Well, the easiest way to think about it, well, it's a new governmental website. And think of it this way. It's a place where you can go to do some comparison shopping on prescription drugs.
So is it insurance?
No, it's not insurance and it's not a pharmacy. You can't buy drugs on it. Think of it as a catalog where you can look up prices. And there's a portal on the site where you can get redirected to the drug manufacturer's direct-to-consumer website. And it's at that site where you'll be able to purchase medications, but you'll have to do it with your own money, meaning you can't use your insurance.
Do you get reimbursed? Is it cheaper? Who is it for?
Those are questions that we don't know definitively. It should be cheaper. It's meant to be cheaper. And there's a big reason for that. For a long period of time, we've actually subsidized the rest of the world. We pay for research and development for pharmaceutical companies, and then these drugs get sent around the rest of the world. And unfortunately, we've actually had higher prices than a lot of other countries, even for drugs that were made here. So the idea behind this policy is called most favored nation pricing, where the U.S. really won't through an agreement with the pharmaceutical companies, where the U.S. won't allow other countries to have lower pharmaceutical prices than we have to pay. Now, what that means for you is that if you actually have insurance, there may be examples in which the insurance plan still has a lower price because the insurance companies also negotiate with pharmaceutical companies to lower prices. So that's why I said it's kind of a catalog. Go there, check the prices, see if your insurance will have a certain price, see if the government was able to negotiate a better price. Sometimes it'll be better, sometimes it'll be worse. But what you asked that is yet to be determined is whether or not you'll actually be reimbursed or able to use this against your copay or deductibles. At this point, it doesn't look like that's the case.
So what's the point?
The point is to get the price of pharmaceuticals down. And that's actually an important thing by itself. Let me give you two examples because I don't want to say that this is without value. Right now, just look at Ozempic. The price of Ozempic is about $1,000 a month. The government's actually been able to negotiate that price down if you go through this website to $350 a month. That is significant. Similarly, there's a medication called Trulicity. That's a diabetic medicine produced by Eli Lilly. And that's now going to be priced on this website for $389 a month, which is almost $600 less than the list price. So don't make too much of it and don't make too little of it. It's an option. It's a catalog. Go there, see what the pricing is, compare it to what you have in insurance or what you could otherwise get, make a decision if it's right for you. You may save money. Sometimes you will, sometimes you won't.
So if I go there, find out it's cheaper on that website, will I take a hit on my insurance in any way, shape, or form, or is it just separate?
So it's separate. The people that are going to benefit are people who are uninsured, people who are paying full cash price, people who need these expensive name brand drugs, and people who have high deductible insurance plans. That's not everybody. So there are examples in which you will benefit. If you go there once and don't benefit, don't just disavow it. Go back another time. You may find it's discount shopping. It's nothing more than that. And it's not a place where you can buy the medicines themselves. It just refers you to the pharmaceutical companies' websites where you can see if there's a deal to be had.
So do we know what drugs are included on this?
Well, negotiations continue, and early on, negotiations have been completed with 16 different pharmaceutical companies. So that's not insignificant. There's a lot of drugs. There's not a comprehensive drug list that's been released, but there's been some significant ones. I mentioned Wegovy and Trulicity, Ozempic, Zepbound. There's some cholesterol medicines, other diabetic medicines. There's a list. Go to the website. You'll see a full list, and I would anticipate that list would continue to grow over time.
So the upshot is it could be good, it could be bad, but check it out.
Could be good, should not be bad. The bad would be that it didn't turn out good.
All right. Thank you so much. Appreciate it, Dr. Sterling. Take care. Bye-bye.
Take care. Bye-bye.